I'm Jean Varlin Peredaza, base RT3. Congenital clubfoot AP projection guide method. The typical clubfoot or Talip's equinovarus shows 3 deviation from the normal alignment of the foot in relation to the weight-bearing axis of the leg. These deviations are plantar flexion and inversion of the calcaneus, equinus, medial displacement of the forefoot or the adduction, and elevation of the medial border of the foot or the supination. The classic kite methods exactly place AP on lateral projections for radiography of the clubfoot are used to show the anatomy of the foot and the bones or ossification centers of the tarsals and their relation to one another. The position of the patient: place the infant in the supine position, with the hips and knees flexed to permit the foot to rest flat on the IR. Elevate the body on firm pillows to knee height to simplify gonad shouldering and leg adjustment. Rest the feet flat on the IR with the ankles extended slightly to prevent position of the leg shadow. Hold the infant's knees together or in such a way that the legs are exactly vertical. Using a lead glove, hold the infant's tucks when the adduction deformity is too great to permit correct placement of the leg and feet for the bilateral images without overlap of the feet. Each foot must be examined separately. Congenital clubfoot lateral projection medial-lateral kite method. The kite method lateral radiograph shows the anterior talar subluxation and the degree of plantar flexion or the equinus. Position of patient: place the infant on his or her side in as near the lateral position as possible. Flex the uppermost limb, draw it forward, and hold it in place. After adjusting the IR under the foot, place a support that has the same thickness as the IR under the infant's knee to prevent angulation of the foot and to ensure a lateral foot position. Hold the infant's toes in position with tape or a protected hand. Congenital clubfoot axial projection dorsoplantar Candle method. Candle recommended the inclusion of a dorsoplantar axial projection in the examination of the patient with a clubfoot. For this method, the infant is held in a vertical or a bending forward position. The plantar surface of the foot should rest on the IR, although a moderate elevation of the heel is acceptable when the equinus deformity is well marked. The central ray is directed 40 degrees anteriorly through the lower leg as for the usual dorsoplantar projection of the calcaneus.